Good afternoon from South Norfolk here in the UK. It's the 23rd of November, wet and wild and windy outside, so there's no better place to stay than indoors. Thanks very much for anybody who's watching this video. I had a few comments in the last few weeks to say that could I do like another one video from sort of start to finish really. When I post my videos, a lot of people who don't follow me don't get to know exactly what's sort of happened to me over the last couple of years. So one of the videos that are doing quite well at the minute is top 10 tips and tricks from last year, but that doesn't paint the whole picture from start to finish. So I'm going to try and do 5 or 6 little videos together and explaining just a little bit at a time. So I'm 54 years old, from the UK, and got diagnosed with prostate cancer 2 years ago. Gleason was 3 + 4, and I had 5 out of 16 positive on the tumour. So section 1 is called before surgery. When I got diagnosed, it probably was the worst day of your life, but you soon had to man up and say to yourself that you need to work out what's going on and get your head around it. One of my tips was to try and research whatever you can on YouTube or by reading books onto what condition you've got and what surgery you want, whether it be the prostatectomy, brachytherapy. There's loads of radiation. There's loads of different things what you can do. What I decided to do was speak to people. That's one of the best things to learn about the prostate cancer, is to speak to people who have been there and done it, listen to their testimony and get some tips and tricks from them and what they do to help them. We all look at Google for different things. I won't say Dr. Google, but for me it was very, very helpful to work out and understand what was ahead of me. Googled a lot of the words, I could understand what was going on. So when I went to see my urologist surgeon, I could understand exactly what he was talking about. And I decided to go for the prostatectomy, which is the removal of the prostate, purely because of my age, to be honest. I thought if it's out of the body, then we've got a chance to recover better. So tip 1 is to learn as much as you can about what's ahead of you. So we're going to go on to section 2 in a minute, and that is actually the operation. So the operation, mine was on the 4th of April 2023. I had to be at hospital 7:30 in the morning. I had to take all the medication and overnight clothing. You're meant to stay in hospital for one night and they release you the next day. So I'm in at 7. Doctors come around just to check all was okay, check your wristbands. I wasn't sure what time I was going down. It's just sitting in a little waiting room in a little ward next to your bed, and you have various different doctors coming around who so they just check your details just to make sure everything is all right, and just check some blood pressures and different things. So I was told by 10-11 o'clock in the morning that I was the afternoon session. Each operation lasts 3 to 4 hours, and I was to be in at 1 o'clock after they'd been to lunch. So I got taken down. I walked down to theatre and laid on a bed. Just explained what the procedure was. I'm going to put a cannula into me to then inject the general anaesthetic, and then you just go to sleep. So he comes around, just explain a few different things, and you've got a nurse there who's just trying to calm you down and just talk to you. So for the first, you feel a funny sensation with a general anaesthetic. It sort of goes cold for about 2 seconds, and then you're out. You don't obviously know anything about it. Had a nice sleep for 3 to 4 hours, and then probably about 4 or 5 o'clock that afternoon you get put into recovery. You wake up in a recovery room with a nurse talking to you, and then you're transferred to your ward with this strange bag coming out of your manhood. It was a very weird feeling. I didn't feel much pain. You're linked to a drip of painkiller, and I think the strangest sensation was your body wanted to go to the toilet, but you daren't go into this bag. It's not natural. But after after 10-15 minutes, you don't know nothing about it, and all of a sudden you see your bag filling up. The big tip there, the one big tip I will give anyone, is to listen to the nurses when they say drink water. Make sure you drink as much water as you can. You've had a big operation, and there's a lot of rubbish inside you that needs draining through a very, very, very small Foley catheter, probably that size. And there's some funny stuff that comes from your bladder to this bag. So if you don't keep hydrated and you don't keep it flushing through, you are going to have problems. That is my one big tip. Drink. And I got wrong a few times by not drinking enough. They know by the colour of your pee, it should be a light yellow rather than an orange colour. So please just drink. If you don't, then you're going to suffer like me. I had a block catheter where you started peeing yourself, and it's very unpleasant and it's not nice. You're peeing outside the tube and it just goes everywhere, and they literally have to put a test tube. There's two things that come out your catheter. One goes in a bag, and just like a second one where they'll put a saline solution, and it just sort of puts it back into the bladder, and it's not nice. And on the second occasion, 10 days later, I had another block catheter purely because I wasn't drinking enough again, and had to return to hospital and have one taken out and one reinserted, and it's not nice, believe me. It doesn't hurt, but it's just very, very, very unpleasant. So that's my number one tip, just to drink plenty. The next day when you wake up, it's not uncommon to have a lot of carbon dioxide within the body, so you are going to fart all the time. You have to. They encourage it. It's not the sort of thing you do, but for me, I got lucky. I didn't have a lot of carbon dioxide inside, but there's a lot of men on my ward who did, and there was quite a few people playing tunes around the ward. So once the carbon dioxide is out the body, you start to feel a lot better. So the next day you should go home in the afternoon, but again, because I had a few problems with the catheter, I had 2 nights in hospital, and then got sent home the next day. So yes, just make sure you drink plenty, and we'll go on to the next section, which is section 3, the weeks after your operation. Weeks after, yes, you're very sore for the first few days. I had probably 6 wounds within the body, which were glued up. I suppose they put little steri strips in there to tighten them up, to bind them together, then a glue. And this glue probably takes 2 or 3 weeks to dissolve, and by hopefully after that the stitches were okay. Big tip, just make sure you do little by little, bit by bit. You're no hero. Your body needs the time to recover. And yes, what I done for the week after, for the first few days I just took it steady, but then I needed to go out because it was now coming into May time, early summer, and we done a lap or 2 around the garden. The next day done a little bit more and a little bit more, and just increased it just that little bit more. They do encourage you to exercise, and yeah, just keep building up, just a bit by bit. So you need to look after your wounds. I got a little infection in one of them, which needed a little bit of doctor's antibiotics just to clear that up. And you need to keep an eye on the showers and everything. You need to cover up as much as you can, so you can't, the water doesn't take the glue off, and again, which will lead to an infection. So in the UK here, we have our catheter in for about 14 days. And I know the US are a lot shorter, maybe 7 to 10 days, but in the UK I think standard is 14 days. And to be fair, it's there to help you recover. It's I personally think it's something you need. Different people are different when they healing time, but it was 14 days. One of the tips I did give in my previous videos was that for me, what worked in the evening time, night time, was sleeping in a recliner. I slept in a recliner. I put a couple of cushions by them aside, and then overnight I couldn't move too far. Yes, it was a little uncomfortable, but you soon get used to it. The problem laying in bed is you've got your catheter coming out, and the catheter has to be, the bag has to be below your level. So if you're sleeping in bed like that, then your urine can't go anywhere. You need to be slightly declined so it goes into the bag. So I thought, I don't know. And also, if you're going from side to side overnight and you might pull the catheter, it's not nice. So I thought, well, I put a bucket underneath my recliner chair, and in the bucket was the catheter bag, and it can only go one way. So that's just a tip that worked for me. Some people use it, some people don't. As I said before, after 10 days I had to go and get my catheter removed and another one inserted because we had a blockage, and that was purely not drinking enough water. I'm not a big water drinker, and I know a lot of people aren't also, but just do it. Just please do it. 2 weeks of your life, just drink as much as you can, and that'll just flush everything out of your body. Section 4 is regular blood checks. 6 weeks after, here in the UK, they will do another PSA, and that is to see whether your operation has worked successfully. Again, I know in America and Canada, I know they're probably a little bit longer. They're probably 2 or 3 months, but here in the UK, mine was on the 21st of May and my operation was the 3rd of April. So it's probably about 6 weeks. The result you're looking for is less than 0.1 undetected. And I got 0.1, so I got less than 0.1, and the most important thing is the less than sign. I got this result, and for me personally, I thought it was the end. I thought they'd got everything. Little did I know then that obviously there's a relapse and reoccurrence can occur, but that just takes time. So I was happy, done a YouTube video, and to this day, this YouTube video I think got 60,000 views, which was just fantastic for me, and that just led me to keep doing other videos. So that was in May, and I went to Latvia in August with my partner, and I'd done another blood test and it come back 0.1. I'd lost that less than sign, so it's less than 0.10, and now I was between 0.10 and 0.20, and I started investigating. Where was I? Was it going up? Was it going down? I just didn't know where I was. I was just trying to learn everything about it. Hence, a lot of my videos will go on about a second decimal place private blood test which I take. So in the next 6 months to 9 months, I've done a private blood test against the NHS one, and here in Norfolk, our NHS trust will do only one decimal place. In the next 6 to 9 months, I was 0.1, 0.1 and 0.1. But my private one was going 0.13 to 0.16 to 0.19. All still 0.1s, but it painted a totally different picture. And as I say, if you watch my videos before, I will explain how one results are going up and one result is the same. So then 0.20 is normally the sign of a reoccurrence. And we start the asking about what happens next. So the issue I had was one of my tumours was what they call a positive margin. Positive margin is basically something on the edge of the prostate. So as I said, I had one just there, and it obviously escaped to places outside, whether it be the nerves, and my surgeon had cut back the nerves just a little bit. He couldn't go too much because he did say to me, any more then I could be wearing nappies for the rest of my life. So he just trimmed up where he could, but unfortunately it probably escaped just a little bit more from there. So with a positive margin, you have 30 to 40% chance of having a reoccurrence or a relapse, and I was in this, going towards this on 0.19, going towards this reoccurrence. After a good chat with my surgeon, it was agreed that he would try and push me to oncology, which is the radiation section. But in the Norfolk where we live, the 0.40 is the test result that they need to do a PET scan, PSMA scan, to see whether they can detect it or not. And they did say if at 0.20 or 0.19 there'd be a chance if I had the scan that they wouldn't pick up nothing. But I said fair enough, but we agreed that we'd give it a go, because in 6 to 9 months time, if it got to 0.30, then we could have another one. It's not like you just have one and that's it. You can have 2 or 3 if you want. So we decided to give it a go at 0.19 to see whether this PSMA will pick up where it's gone. Is it in the lymph nodes? Is it still local? So, which leads me on to the so I was a Gleason score 3+4, and if all those people who knows about Gleason's, it's 3+3 is like a standard active surveillance, and 3+4 is the best one. You can have a 4+3, a 4+4, 4+5, and a 5+4. So I was the second one from the bottom. So it was on the march, but it wasn't an aggressive one. So we were very, very lucky that my urologist had arranged for radiation to take over, and they agreed to radiate pretty much 2 years in advance. You can remember I was 0.19 and I had to get to 0.40. Well, 0.13 to 0.19 took 9 months. So I knew that it would be 18 months before I got the radiation session, but they agreed to radiate early. They radiated the prostate bed, and we had that this year, April, May, every day for a month. You had the weekend off. Again, in the US, I know they do more sessions. They probably do 30, 35. Where in the UK here we've done 20, which seems to be the norm. It's called EBRT, external beam radiation therapy. There are some that do 5, which is a very more intense, but it was decided that 20 sessions to try and clear up the prostate bed was my way going forward. So the radiation itself was wasn't tough. The toughest thing about the radiation was prepping yourself to go there. I had to drink 2.5 litres of water before I went, and normally by 11 o'clock in the morning I was going to the toilet after 20 minutes, because what people don't realise is that the first part of the water you drink in the morning goes to your bones and your muscles and your organs, and when that's had enough, it then obviously fills your bladder up quickly. So I was drinking sort of 500 mils every hour, starting at, I don't know, 7, 8 o'clock in the morning. And by 11 o'clock, I would say I was going to the toilet every 20 minutes. So I knew that I'd had enough. So also, you just got to be careful of what you eat. If any part of you, they try and radiate an area which is part of your bladder as well and part of your bowel, and the less you put, how can I explain? The less, if that's your prostate area they're radiating, the less of the bladder that gets radiated, the better. The more you can drink, the more the bladder expands. And say, if they can try and radiate 10%, then you're going to recover the next day. Same as your bowel. You've got to be careful what you eat. You don't, any part of the bowel what's in the radiation bed, they probably won't do. When my appointments come in, I was normally mid-afternoon, early evening. And when you arrive, I arrive say 4 o'clock. They give you an enema, which you place up your bum, and then hopefully that then gets rid of all wind and excess poo that's coming down. And then you are meant to empty your bladder as well. You then go back in the waiting room, and they have always they measure out how much water you need to drink before your radiation session. Mine was 450 mils, and you have to keep that 450 mils in. They work out exactly what your bladder can hold and how much your bladder can expand, and they worked out 450 mils as my limit. Go back into the waiting room at say 4:10. My appointment's at 5 o'clock. So 4:10, you drink your water. You've got to drink it all, and you can't go to the toilet. You cannot go if you're bursting. You can't go, because then it's just wasted. So you're going to have your radiation session, and anybody who's interested in watching a radiation session, I have done a video on my channel. I put a camera there. You'll see me laying on the bed. You'll see all the radiation accelerators coming around you. It comes around. They take a scan. If your bladder's okay, if your bowel's out of the way, they will start. If there's anything not quite right, they won't do it. One of the worst things for me was something you can't control is wind. Again, you have to be very, very careful what you eat. I wouldn't be eating baked beans the day before, because you can't control it. Again, if there's a pocket of wind that sits in the radiation beam, they won't do it. They literally just won't do it. So all they'll do is basically say to you that we'll put the session on to the end of your treatment. And for me, I had 2 extra, and both of them was, although I was drinking plenty, we were talking about coming towards early summer, and some of the days were warm, 22, 23 degrees, and I was sweating more, which means you lose more fluid. And what they try and do is they will scan you and say, look, your bladder's 75%, go and drink some more. And if they give you some more water, then they will do it. So we've done the 20 sessions, and there wasn't no problem. Again, if you watch my radiation video, you'll see that it doesn't hurt. It's just the side effects afterwards and during, which are the pain. Yes, your stool's a little bit more loose, urgency to go to the toilet a bit more, sort of day 14, 15 onwards. But apart from that, it was quite easy going. But afterwards, they always say to you that the fatigue will hit you, and yes, it tuned me up, knocked me for 6. And again, you just have to take your time. A week after, 2 weeks after, I was going to bed at, 6 o'clock at night, just to get the rest. And you just have to take your time, little by little. I went back to work, and I was struggling at work just to walk up the stairs, out of breath, fatigue, and it does get you, but just little by little, and you'll get there. So where we are now, it's now November, and so I had my radiation in April, May. The first blood result after the radiation, which was July, I'd gone from 0.20 down to 0.07, which was the oncologist doctor was very happy with. And the October one is now 0.04, so it's going in a downward spiral. So we're very happy with that. So we're not going to be seen for another 6 months, but I will do another private test in January, which is another 3 months, and I'm hoping this could be 0.01 to 0.02. So we're in a good place. Christmas is coming up, and so it's the first time in 2 years that we can enjoy Christmas without the worry of what's going on. First year I got diagnosed was Christmas time. Last year was the sign of a reoccurrence. So things are going in the right direction. All have to keep positive, and we can fight this together. Anyone who's unsure and watching this, unsure about getting tested, please just go to your local GP if you can, or a local. We have some people around here who go do like a road show. Somebody will be able to do your PSA. Don't be scared of it. Look at it in a way of it could save your life or it could extend your life. I know within a couple of years of myself, if I hadn't found this, I had no symptoms, just a random blood test in Latvia I had. I know that if I hadn't found it, who knows where it would go. Once it start going to other organs, once it goes to different nerves, it can go to around your body, and it gets so harder to treat. I'm lucky it was kept at stage 2, which is localized, and I'm lucky that someone on that day made me go for a blood test in a random place 2,500 miles away. So please, if just go and get tested. It's very cheap. I say, if you speak to your doctor, you've got any concerns could be 2 or 3 times a night getting up for a wee, the urgency, pain, blood, there's a lot of different symptoms, but there might be no symptoms. Doctors are reluctant to do a PSA if you haven't got any symptoms, but it might be your father, it might be your grandfather, it might be your blood. If your father's had prostate cancer, 75% that you will get prostate cancer as well. So just please go and get tested. I've had people come up to me in the last few months and said that they spoke to me, they've seen the videos, they've gone and got tested for no reason, just out of curiosity. I had one guy from Devon who's 250 miles away from me, said spoke to me at a bowls tournament and said that he's seen my videos, he's gone and got tested, and he's just now finishing his radiation session because he's got prostate cancer. And I've always said that doing these videos, my main aim was to try and help one person to go and get tested, and I've certainly done that with a lot of comments I've had in the last couple of years on these videos. So thanks very much for anyone who views the videos. I do enjoy doing them. I hope that I can try and help people, and as I say, I give out my email address to anyone who wants any questions. I'll answer them. My email is lowercase Neil Davidson 5959 at btinternet.com. I have people who do get in contact every week, to be honest, and I try and help them with all different things, whether they want some advice. I try and push them obviously to my channel to try and see if there's something on here that I can help them with. I try and give them addresses of where these road shows are going to be, and we're just trying our best to try and get the word out and trying to get as many people tested, and obviously to try and save as many lives as we can. So thanks if you've now lasted the half an hour. But I want to try and just put everything into one. A lot of people who do watch my videos come in halfway through and then start asking questions when they don't really know what's going on. I had a couple of comments in my last video where the person's sort of slighted me a bit about my private blood tests. I don't think you really know the exact whys and whens. So hopefully this will just be an all-in-one sort of the journey so far. So many thanks to everybody who do subscribe, who do view, because as I said before, any money that we do make on YouTube goes to Adherum Cancer Care, a place here in Norfolk, and I'm sure they benefit from a few pound here and there. So again, many thanks. Have a lovely Christmas, and we'll do a video sort of in the new year. So thanks very much for watching.